Go.
Good morning. I'm Dr. Benzuli. I'm one of the anesthesiologists in the department at Brown University, and my residents have, over many years, have asked me to record my technique for doing IV access, and my technique is different than most, so I will go through all the steps, and over the years it's come from my name that these are Zul's rules. So I have a series of Zul's rules. Today will be the first of the installments on how to start IV. And in this way, these are the 5 S's of IV successes, and I'll go through them right now. First, I want to talk about how we normally are taught to do an IV. You first put the tourniquet on, you wipe with alcohol, you take the needle, you go in at a certain angle, and once you get blood flow, you drop your angle and then advance into the vessel. That's fine, that works for many people. Many people are outstanding at doing that. I am not at all saying my technique is better, it is just different. And I want to go through and explain to you by starting with the failures of that technique, and then showing you my solutions to those techniques. So the first reason, that most common reason that people say that they have an IV failure is because the veins roll. Patients say that all the time. Doc, my veins roll, people can't get my IV started, it's really difficult. So the issue there is that the vein is a moving target. It should roll, and the problem happens to be that it's user error. The person who's starting IV needs to secure, that's the first S, to secure or stabilize the vein. It is much easier to hit a vein that is not moving than one that is moving. So by doing that, can I borrow you for a second, please, doctor, there? Okay. So in the hand, for example, the veins move back and forth, correct? But if I bend the elbow and bend the hand and put my fingers under the knuckles, it's important to put them under the knuckles, and do like this, the vein doesn't move at all, okay? That's securing or stabilizing the vein, so that when I try to hit that, the vein doesn't roll away from me. If I'm working on the arm, for example, on the inner surface bone, I couldn't have chosen a better model. I can see them from across the room. So if I pull, you can see these veins here. Can you see those there? Okay, now, the way to do this is you stretch the skin from behind. That's the other S, you can stretch. Now, I'm losing it because I don't have a tourniquet. Can you grab a tourniquet for me? Thank you. Oh, this is great. Off camera, I have so much help. It's unbelievable. So here we go. So we're gonna tie. This is your arm will fall off in about 5 minutes, okay? But in the meantime, I'm gonna show you how we're gonna fix this up. So you can see the veins there, and when I squeeze her arm from behind, you can still see the vein. It's right there. I don't lose it. But what happens is that vein doesn't move at all. The vein moves, the vein doesn't move at all. Now, you have to make the skin as tight as a snare drum. It should not move. So if I take a catheter, there's an IV, I'm gonna pull it a little bit like that so I don't stick her. If I do this and I push the skin and the skin moves, well, I've defeated the purpose. What I need to do is to pull the skin as tight as possible. Now when I put it in, the skin doesn't move at all. See that? I don't know if you can see that on camera, but here the skin is really wobbly, and here the skin doesn't move at all. Now, if I take this catheter and I put it right on top of the vessel, and I push down the tip a little bit, just like that, my needle and the vessel are in the same plane. All I have to do is push through that millimeter of skin, and since I've pulled the skin tight, the subcutaneous tissue is pulled away from the vessel comes up to the surface, and then when you go in, you just stab the vein. You just punch it in. Now, I just mentioned stabbing or slaying. That's the second S. So the first S is to stabilize the vessel. The second S is to stab or slay the vessel. Now, what I mean by that is by stabbing, I mean punch it. Punch your needle in, or go in a steady way, like slaying, like you're gonna run somebody through with a sword. Now the reason I do that is because the second most common reason that people complain about missing an IV is they get blood flow but they can't advance the catheter. Well, that's because the tip of the needle, when it strikes the vein, you get blood and blood comes up your catheter. but the catheter is not in the vessel. There's a distance between the end of the needle and the end of the catheter. You have to cover that distance. If you use the momentum of punching it in, by the time you stop, your vessel, your needle, and your catheter is in the vessel. Okay? So the second S is to stab the vein or slay the vein. So you have to secure the vessel, you have to stab the vessel. The third S is you want to go in a straight line. All right? Some people teach, I'll have to borrow you again. Some people teach, like for example in the hand, you have this vein like this, and some people will teach you to come from the side of the vein and go in like this maybe. Now, I'm not a big fan of that, and it's fine, it works. That's actually the way I was taught to do this. I prefer going right on top of the vessel. You can see exactly what I'm doing here. So the vessel, I'm pulling the skin tight, my needle, my tip of my catheter is right on top of the vessel, and if I just punch it, I'll be right in the vessel. So the reason I like this better is if I go through the other side, which is another failure, I will show you how to save that IV. But it's better to hit the vessel and be through the other side than it is to not just to blow the vessel or not advance your catheter. If you can't, if the tip of the catheter never goes into the vessel, you cannot save it. If it goes through the other side, you can save it. So that's the second and the third. First one is secure the vessel or stabilize the vessel so it's not a moving target. The second one is to start to stab it or slay it. The third one is to go in a straight line. The fourth S is the sine angle. Now I know this is really getting into some geometry and everybody says, oh my God, I forgot all about that. And I'll just show you that it's the angle of approach to the vessel, okay? So one of the things you do with ultrasound, right, when you see it on the screen, you can see the tip of your needle in the vessel. And if you just try to advance it, then you're not gonna get the thing in because your catheter tip is not in the vessel. And so what you do is you walk the needle right up you walk the catheter right up the vessel, correct? All right. So if you took the ultrasound away and you visualized that, what you might visualize is that if your needle and catheter is in exactly the same plane and orientation as your vein, then you can keep advancing straight and the catheter and the needle will go right up the vessel, right? So, the angle of approach in the hand, when I bend the elbow and I bend here, I can do this, and you notice that the catheter and the vein are in the same plane, and so if I advance like that, I'll just go right up the vessel. That's pretty obvious in the hand. Okay, so I'm going to rotate your hand so Harry can see that. See that angle there between the catheter and the hand is about 15 degrees. Okay, so if I try one on the arm, got to do a tourniquet again for you. If I do this again on the arm, what happened to it? Here it is. It's just camouflaged. If I do this on the arm, I can't bend the arm. So I go in like this and then I run into arm when I try to advance my catheter. That's a very common complaint that people have. But if you bend your catheter, I usually use the plastic hub so I don't contaminate my catheter. But if you bend like this, that angle is approximately 15 degrees. And now I'm going to have to advance it so I don't stab you, okay? Or slay you, for that matter. When I do this like this, now I can see the vessel, right? See the vessel? Maybe I'll take this one right here. This is pretty obvious. I'll do this. I'll lay it on the skin. I'll punch it in. But look, I can just advance this straight up. So the needle, the catheter tip and the needle are also in plane with the vein. So I prefer that technique, which is the fourth S. So let's go over these one more time, at least one more time. The first S is to stabilize the vein. You do that by pulling the skin tight. In the hand, you bend the elbow at 90 degrees, the hand at 90 degrees, and you put your hands under the fingers. Why under the fingers? Because if I'm like this, I can't get the right angle. So I bring my hands like this, the vessel doesn't move. I then put my needle tip on the vessel, I push it down slightly so that my catheter and my vessel are in line with each other in the same plane, and I just advance it right in. If I'm doing that on the arm, I bend the needle at 15 degrees. I hold the skin from the back and I pull tight, tight as a drum. If you have somebody who has big arms, you may have to have another person hold the vein above so that the vein doesn't move, or the skin doesn't move. Because you can have two movements. The vessel can move, or the skin can move in relation to the vessel. So you don't want this. You want the skin like a snare drum. You want to put it on the vessel and punch it in, or advance it just like that. So you got to be confident about getting your IV in. That's the second S. Stab or slay the vein. Third one, straight line. Fourth one, the angle of approach, the sign angle is 15 to 20 degrees. Okay. And lastly, the fourth S is once you have success, you celebrate. That's it. Okay. We'll show you this all in practice in a few minutes or in the next part of this video.